Thank you.
I appreciate it. Thank you very much. Just a couple of questions. And I was going to touch on the tip workers because, in my experience, when we have considered the possibility of increasing tip workers' pay to a minimum of the standard minimum wage, the pushback from the industry has been rather quick and they've opposed it quite strenuously. So I get it. I understand what you're trying to say, but I would suggest that perhaps the industry itself hasn't necessarily coalesced around what they want just yet. But we'll go back and check.
I'm sure the industry in New York continues to be opposed because it's a cost savings for them. So they would prefer. So I wasn't suggesting that the restaurant industry.
Not the restaurant industry.
Oh.
The tip workers.
Oh, the tipped workers.
Tip workers themselves. They have their own association. They came in and said, "Don't touch it. Do not touch this. We do not want you to touch this. Leave it alone." And so I understand. We will revisit.
With respect, I think for the tip, they may be ambivalent about eliminating tipping.
Mr. Son, it's not an argument. I'm just telling you it's what happened. But to the extent that we have discussed various economists, there are economists out there, and I would hope that you would acknowledge that have significant concerns about the prospects of going to $15 an hour in a state like ours. And these are not outliers. These are not fringe elements. These are not reports or economists to be discounted. These are among the most well-regarded economists in this country who have written reports. I've got copies of them right here, who have said, we have to be very careful here because we may not get the result that we want if we have such a large increase. Yes, Parent, I have to understand, and I assume that you are familiar with these reports. What would you respond to that?
Yeah, so I would say that mainly what that derives from is the fact that there's not a sort of a well-established academic literature that's looked at the sort of increase that we're talking about to something like $15. There are reports, though, and these economists who say that they have reservations about going to 15 because they haven't seen good studies on this. I don't know that they've issued sort of detailed, analytical, empirically based reports that they're making. What? So it's their impression. Now, if you look at the reports like the Los Angeles study, which is very detailed. It's a micro and macro combination. It looks at it sector by sector. It looks at the effect of higher wages phased in on operating costs of businesses, which are different in every industry of the economy. And then it sort of builds up the overall conclusion from that. And Paul very, very appropriately summarized that as, there are going to be, as we've heard, there are going to be some savings related to reduce turnover, and those are significant. It doesn't go all the way in terms of covering the increased costs, but it's pretty significant. And it's difficult to measure because that's one of the things we don't have a lot of experience with is what the impact on morale is going to be when a worker goes from $9 or $10 to $15. It's clearly, when we think about the impact on workers, it's going to be life-changing for many of these workers. That will have an effect in the workplace. And hopefully employers will see some benefit of that in terms of they can sort of go home at night or go home early sort of, confident that their, more dedicated workforce is going to, keep good control of the business in their absence. So, and then on the other side, if you look at the positive effect of the spending of the increased wages and what that does, it sort of offsets. And since the wage structure is a little bit higher to begin with in New York overall than it is in Los Angeles, it could be that the very slight adverse employment effects are not even present in New York when you do the balance on that. So these studies, or this team of economists at University of California at Berkeley, have an exemplary track record in terms of the credibility of their past minimum wage research, looking at the sort of the smaller incremental increases in the minimum wage. So they certainly know they have a lot of credibility in terms of their analytic skills in doing that. So they're bringing that experience to bear in looking at a phased-in $15 increase, taking this sort of new approach of looking at it sector by sector in the economy. And I think that over time, as these more prominent, respected labor economists become familiar with those studies, I think their reservations will be addressed. Now, Krugman, for example, who's very on top of a lot of literatures because there's a lot of pressure to sort of comment on the issues of the day. At a CUNY forum on October 1st, I was there. I heard the man say it. He was very impressed with the empirical literature, the sort of research from the Berkeley team, and he's thought about the impact of New York going to 15, and he says he sees no problem in that. He's a Nobel laureate economist.
For New York City? For the
No,
area.
for New York. He was talking in terms of New York State.
I'll have to go back and look.
Yeah. I can send you the link to the tape. It's actually in my testimony.
Well, then I will.
Okay.
I will find it myself. You mentioned that, again, going back to the $15 as a current rate based on past minimum wage, 1970 adjusted for inflation, and then cost of living. Cost of living where?
So the cost of living in New York State overall.
Okay,
in 2015.
As opposed
So
to
if you adjust
opposed
it,
to 1970.
right. If you adjusted, you took the 1970 peak minimum wage
Right.
in New York State and adjusted it for the consumer price index and for the higher cost of living, reflecting the change in the cost of living in New York since then, not just the consumer price index,
No, I understand.
but a higher cost of living.
In Binghamton, in Buffalo, or in Manhattan, because I would assume that the cost of living has shifted differently in different parts of the state.
Right. So this was a statewide number, but that was for 2015 also. So by 2021, even if it was less than 15 in Binghamton, by 2021, it's very likely going to be at $15 or $16 level.
I appreciate that. I will look for that link. I appreciate you providing that as well in your testimony. So,
Okay.
Thank you. Thank you both.
I just thank you for your testimony. It's kind of refreshing. I'm sorry that it came so late because it would have been nice to have it interspersed, so to speak, with regard to some of the other testimony, because then it would be some sort of balance in terms of being able to use some of what you had to say to ask some of those other folks that had a different point of view and get some more sort of a different kind of dialogue. And so, but I think that I want to thank you for being able to provide us with another point of view. I would assume if it can happen in Harlem, it can happen in other places as well, because the cost of living is is a challenging there as well. So so thank you so much for your being patient and providing us with such an insightful report.
As always.
As always.
Gentlemen, thank you.
Thank you.
Thank you, Senator.
Good hearing.
Congratulations.
Okay.
See you.
We next have Michael Searider. Searider, thank you. President and CEO of the New York State Rehabilitation Association, and Ann Hardiman, Executive Director for the New York State Association of Community and Residential Agencies. Thank you both for your patience. Thank you for being here.
Thank you.
And thank you for coming and representing such a critically important element of this discussion that oftentimes goes overlooked. So thank you.
Thank you.
Thank you. I'm going to start if you don't mind.
Of course.
And thanks for having us. As organizations, and NYSACRA represents agencies, not-for-profit agencies all around the state, as does NYSRA.
Correct.
We've long advocated for increased funding for paid individuals that support people with disabilities, and we're really pleased that this discussion is happening. It's been very interesting today. I just want to say, though, that we feel direct support professionals, people that work with people with disabilities, have been underpaid for some time. And it really is representative in their wages, in the respect that that job sort of entails. They love their work, often have to leave to get a better job, to get paid a better and to make a living for their families. But all of those wages are directly linked to public funding, to Medicaid. And, it's in order for them to keep pace as the minimum wage perhaps goes up, we're going to have, we'll call on public funds to increase as well. New York State law, mental hygiene law, assigns the responsibility for those supports to individuals to New York State. New York State contracts or licenses not-for-profit agencies. The bulk of services are with not-for-profit agencies. So the revenue is almost totally from those public sources. We have a report that we attached and will leave if you don't have one at hand. But over 90% of DD providers are funded by Medicaid. So the challenges already exist. Many of our members are already experiencing 15 to 20% recruitment and retention vacancies. As the economy improves, we're often challenged to hire enough workers. So we're already a bit in a disadvantaged place. The workers, when there's vacancies, 1 in 5 people missing in a vacancy, there's either a person working overtime or a vacancy and somebody's working harder. It's a very stressed workforce. So I think one of the other points I wanted to make, and I think you brought it up, Senator, was that this is human beings. We can't automate. We, as perhaps the fast food industry can, we really are talking about needing those workers. I guess the other point I wanted to make is that about 80% of the funding to any one not-for-profit agency goes to the direct support professional staff. As the fast food, we're already competing with that settled fast food increase. We compete with that workforce. So we're experiencing that disadvantage, and if the minimum wage goes up, which we would be happy to have it go up if we were compensated by government. And now I'll let Michael make his points.
Thank you.
Yeah.
We've done some estimates on the costs associated with an increase in the minimum wage, according to what we've been talking about today, of the scale of the process that has been laid out by the governor for fast food workers and state workers and now university workers. That estimate is $1.7 billion for this field alone, the developmental disabilities field. That is a federal and state share of Medicaid. That would be one half of that would be the state's responsibility, and the state would need to request essentially from the federal government participation in the program at that level going forward.
Or pick it up itself.
That's correct, or pick it up itself entirely. That estimate is based on two primary areas. One of which is that we can't afford to lose any ground with regard to a minimum wage as it either stands now or as it increases. As Ann was talking about before, we have now unsustainable levels of staff recruitment and retention challenges that place these organizations in an extremely compromised position to maintain quality services. The starting wage for individuals in the developmental disabilities field ranges from $9.62 an hour to $10.78 an hour, depending on where you are throughout the state. We frankly can't afford to lose any more, any ground when it comes to that, given those those issues associated with remaining competitive and attracting high-quality individuals to do the work. The second issue has already been discussed by several people today, this issue of compression. We have several layers or at least a couple layers of management, if you will, that would be above those people who provide direct support services. Many of those individuals are not at $15 either. Or if they are at $15, we then need to be thinking about what takes place for those individuals, because it's simply unrealistic from a management perspective to expect people to do the same job or to do different jobs for the same rate of pay. Yes?
The $1.7 billion figure, does it take into account the compression as well?
Yes, it does.
So it's direct salaries as well as
Correct.
that factor, okay.
Correct.
It's a commensurate increase.
Correct. That would be over the course of an implementation period to get to a full $15.
Michael, I don't mean to interrupt you, but has there been any discussion with the Division of Budget about what the effect of the $15 minimum wage would be on your agencies?
Yes, we've been having extensive conversations with the administration around this, sharing the numbers that we've gotten, the estimates that they've been able to put together about the estimated additional costs. Because, as Ann was talking about before, these services are almost exclusively funded through Medicaid.
Right.
And without a requisite increase in that Medicaid rate, it simply becomes a major problem for these organizations that are so dependent on Medicaid as that primary source of revenue. There's no ability to go to a different source of revenue to any significant degree and offset that. If it's insignificant, it very quickly gets to crisis situations.
So what has been the response from the Division of Budget when you tell them that they need to put some more money on the table?
We've been continuing to advocate for that. They're going through that process.
Where they'll get the money.
Yeah, they're going through that process to identify what they believe are those numbers. We believe that that has been part of that conversation. We hope it has. We've certainly been advocating for that for the better part of the 9 months. Pardon?
Have you gotten a commitment?
We've not gotten a commitment at this point, no.
Very interesting.
No. The situation that we have right now is one where we are unable to compete with the fast food workers and others, and including the state of New York, as it hires employees to do the same jobs, essentially, for a smaller portion of individuals with developmental disabilities.
I looked up the difference between the salaries from the nonprofit sector to the government side. It's a significant difference in salary.
45%
Yes.
higher.
Yes. You're looking at costs generally that are about 1.5 times for the state of New York to provide those services as compared to the community-based not-for-profit organizations that we represent.
Well, we like the higher salary rate.
We do
But,
too.
and I don't want to jump in on this, but I shared with Senator Martins yesterday. I think it was yesterday. It seems like yesterday. I started out as a caseworker 25 years ago,
Right.
in working for the city in HRA and the Child Welfare Administration. Now, a caseworker is a slightly higher position than home. What do they call them now?
Direct support
professionals
in the developmental
They
disability
change the
zone.
titles all the time.
Yep.
It's a slightly higher, because you had to have a bachelor's degree as a minimum requirement for the job. But I started out then. My initial annual salary was $24,676, which breaks down to a 35-hour work week, $15.77 an hour. The private or the nonprofit social service agencies that did the same thing, Catholic Charities, Federation, Protestant Board, they were always about $4,000 behind us. And generally, as the city would hire, you would get people who got training in the nonprofit sector, and then they would seek a position working for the government agency because they got better pay and better benefits.
Yes.
That gap has grown
Correct.
Yes.
to an extraordinary gap over the
Correct.
past 25 years.
Correct.
So I think, I'm going to end where I started this morning. We cannot have this conversation about raising the minimum wage across entire sectors without not acknowledging that we have underfunded and undervalued social services in this state for a very long time. That has to be part of this discussion, because if not, we're going to saddle you with unsustainable costs, and you won't be able to meet your mandate, which is to provide services to people in need.
I respectfully, I agree. However, it's less our mandate and it is more the state of New York's
Right.
mandate. A. B, we won't be here.
Right.
Quite frankly, we will not be in business in a very short period of time. These organizations will go bankrupt very quickly if a mandated minimum wage does not come along with the requisite increases in state funding and Medicaid rates. This is one of the most paramount threats that I believe that this field at least has faced directly in a number of years. And as a family member of an individual with a developmental disability, I'm frankly feeling directly threatened by this in terms of the welfare of my own brother.
So I don't think those agencies will walk away very easily, though, because they're very committed. They will try, but it will be a slow, painful death to those agencies.
No, or a valiant effort and then a quick demise.
Correct.
Mr. Seawriter, have you calculated where along the increase, we reach critical mass? Because frankly, I'm just assuming, but I have to assume that the phase-in will be similar to what the governor has proposed for other areas. And so I'm assuming that you also had the opportunity to review that phase-in, and it's not going to 15 immediately. Is there a point in that first year? Do you make it through the first year? Do you get to the second year? I mean, where is it?
You're asking the same questions that Ann and I have been asking of our own members anecdotally now for a number of months, saying, how long are you going to be able to survive? If $15 is the number and there's no money, how long can we do that? My guess, it's going to vary from organization to organization. Many of them were much more financially stable than they are now, even just as a result of some of the activities we've been through for the past couple of years. I think we're in a very shaky place already. Some will be able to sustain much longer. Some will be able not to be able to sustain much longer. My guess is that if I had to put a number on it, off the top of my head, a hunch, I would guess we're in within 1 year to start seeing that process, and it ramps up very quickly from there in a second and a third year to unsustainable levels that I don't know how we would continue to maintain our commitment to pay for the welfare of those individuals.
Were you also asking where in the 5-year, if we use that same period, the bulk of workers well, anyway, the first year is not as significant a year of increases, but I think by the third year, it's pretty all in, and we can share some of the numbers that we've gathered.
My concern is this, and we've seen it, in many ways, but certainly through group homes and the ability to retain qualified individuals to be there, and the turnover rate is something that is unsustainable.
Completely.
Just as you train somebody to be able to do the job and to be able to, frankly, because we're not dealing with robots, we're dealing with individuals and human beings, and each one has their own personality, and each one has a different nature to their disability. They're gone. For what?
Yeah.
To get an extra couple of bucks working somewhere else in retail or somewhere else, because the pay's just not there. And we've heard it time and time again. So we have that facet of it. And then we have the pressure. My concern is, because of the nature of your industries, that as you get squeezed by this mandate, that you will do as best you can. But that comes at the expense of
to the people and the families.
People and families who are being
No
supervised.
question.
Because
The
you're
quality
going
will
to
not-
hold on as long as you can, which
That's right.
means
Yeah.
which means the supervision then will suffer as well. So we get it.
Thank you.
It is critically important that this be discussed, because it isn't just about businesses and it isn't just about workers.
Right.
It's about this element of this discussion. And frankly, I can't thank you both enough for being here. It really is.
Well,
is
thank
that
you for
important.
including us.
Thank you.
We really appreciate it.
Thank you. Thank you both. And with that, that is our hearing for today. For everyone who's here, thank you very much. You can now clap. Yes, thank you very much. That's great. That's great. Thank you. It was very informative, and as the governor rolls out his proposal, which I expect will happen next week, we will be back. Thank you.
No, I have it. I actually have it.
So more clarity on how the settlement rate is.